The next bill on the calendar for today is House File 1829. The clerk will report the bill.
House File number 1829, number 4 on the calendar for the day, an act relating to commerce, the first engrossment.
I recognize the author of the bill, the member from Ramsey, Representative Herr, to explain the bill.
Mr. Speaker, this bill is pretty simple. It just prevents insurance companies from discriminating against living donors. This bill is extremely personal for me. I have a kidney disease. I've had it since I was 16 years old, and I've been able to manage my health. I go into the doctor every 6 months to get my lab work done, but when I get sick, I have to go much more often. I do know that even with this diligence, that one day I will need a kidney transplant. I will be in dialysis and need a transplant. I only have 50% function in both of my kidneys. Chronic kidney disease is one of the most under-recognized public health issues of our time, affecting 1 in 7 adults. There is no cure for kidney disease. The only options are dialysis and transplant. Some donors have faced discrimination obtaining or affording life, disability, or long-term care insurance in the form of higher premiums or non-coverage based solely on their status as a living donor. House File 1829 provides insurance protection for living donors so that they do not suffer economic loss for helping save another's life. Removing barriers to donation can result in more people being able to donate. This bill will also reduce government spending nearly $60,000 annually per patient who no longer will need dialysis as a result of receiving a transplant, while also vastly improving their quality of life. We must protect our heroes, living donors, who have selfishly given the gift of life by donating their kidneys or other organs to support people's lives. Members, I ask for your support.
There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, House File number 1829.
Third reading. Discussion to the bill. I recognize the author of the bill, the member from Ramsey, Representative Herr.
Thank you, Mr. Speaker, and I just want to say really quick thank you to the National Kidney Foundation and the Minnesota chapter for bringing this bill forward. It does have bipartisan support. It is a good bill, and I ask for your green vote today.
There being no further discussion, the clerk will take the roll. Will the clerk please call the names of members who have not yet voted?
Bolden.
Bolden, aye.
Bolden, aye. Christensen.
Christensen, aye.
Christensen, aye. Hamilton.
Hamilton, aye.
Hamilton, aye. Hassan.
Doesn't matter. And it's looking like more.
Hassan, aye.
Hassan, aye. Hausman.
Houseman, aye.
Hausman, aye. McDonald.
McDonald, aye.
McDonald, aye. Thompson. Thompson, aye.
The clerk will close the roll. Members who are voting remotely, please mute your Zooms. There being 126 ayes and 8 nays, the bill is passed and its title agreed to.